We're going to talk a little bit about diseases and biosecurity here. I'm Phil Sponenberg, veterinarian at the Virginia Maryland College of Veterinary Medicine. And this is important because as you get together and as you swap goats around, diseases and biosecurity can become extremely important. Goats have several diseases that are specific to goats and sometimes sheep. And what this means is that if you can control these and eliminate them, you never see them again. And this opens up a really important aspect because then when you're managing your herd, you're going to be making decisions that are based on productivity and not on disease status. And so that helps you make better genetic decisions in the absence of diseases. It is possible to get rid of these goat-specific diseases once and for all. And this allows you, to, again, to make keep cull decisions based on performance, not on disease status. Strategies vary. You have it and you want to get rid of it. Or you don't have it, but you're buying goats and you don't want to buy it in. Most of these diseases that are specific, you get them because you bought them. And that is an important issue. Foot rot. Producers get foot rot in their herd by buying it in. It likes wet and it likes to hide out when it's dry. It's still there, but it can hide out when it's dry. Usually when it's wet, it's more fully expressed. If you have it, you can vaccinate, you can trim, you can cull, you can repeat if needed. Now, when you're trimming, what you need to do is you need to identify those that have the disease, and then you can isolate those in a different pasture. This organism only lasts in the pasture about 2 weeks, and so if you can avoid transmission, you can clean up the entire herd. And this has been done in Australia with an aggressive vaccination, trimming, and culling protocol that basically gets rid of the infected animals and cleans up the other ones. Now, if you're buying goats, you need to be astute. Ask the seller. Not all sellers are going to know. Some of the sellers that know aren't going to confess that they have this disease. So you look for lame goats. See a bunch of lame goats? Think about that real carefully. The other tactic, even if you're buying from an infected property, is you buy weanlings. Buy weanlings early when you wean them. Trim their feet. Quarantine them. Inspect again in a month or so, or you can expect every 2 weeks. And anytime you find an infected foot, you basically move that animal out and either clean it up or cull it. And then basically what you're doing is you're assuring that the first time that you see this is in a weanling's foot, which is a good, pretty decent foot. Depending on where you are, some feet on really, really old goats can become a little bit difficult to manage, a little bit difficult to determine if they have foot rot or not. But if this is a concern, you can definitely clean it up, or, which is hard, or you can actually avoid getting it in the first place, which is easier. Caseous lymphadenitis, these are the abscesses that occur usually up around the head for the first ones, but not all abscesses are caseous lymphadenitis. That's important, because just because a goat has an abscess doesn't mean it has caseous lymphadenitis. Now this one's common in many herds. Many producers ignore it, but it's probably easier to live without it than it is to live with it. And there's different ways you can manage this one. It survives in the environment about up to 5 months. So this is a little bit of a different issue. It doesn't last forever, but it lasts a good long time. And basically the goats contaminate surfaces that they like to scratch on, and that's how it's transmitted. Most herds with it will have at least some goats with an abscess on the jaw or on the shoulder. So if you're buying goats and you see that big lump or a draining abscess, you can be pretty sure that it's caseous lymphadenitis. If your herd has it, it's tough to eradicate it without intervention. So you could inspect monthly and cull those with abscesses, or you can vaccinate, or you can start a clean sub-herd by weaning kids, isolating them from the main herd, and inspecting monthly or every 2 weeks for abscesses. What this does is you're going to cut the transmission. If you cut the transmission, you can clean up the property, clean up the herd. Slowly, you can build up the clean herd and decrease the source herd if that makes sense to you genetically. But what you're going to have to do is you're going to have a part of your farm that's clean, that's been clean for 5 months, that you can put those weaned kids on, and where you can avoid any abscess draining. That's the challenge, but you can meet it depending on your situation. If you're a buyer, castratize over the herd. Infected herds will have some with abscesses if the herd is large enough, and we're talking even anything over 20, 30, 40. If there's cases of lymphadenitis, somebody's going to have an abscess. Buy weanlings. Quarantine them, examine at least monthly, probably every 2 weeks for abscesses. When those abscesses pop up in this situation, you're probably just going to cull that animal. And then basically what you're doing is you're buying weanlings and you're establishing a clean herd from an infected source, and that can be quite useful and quite doable. You can do this. You can cull your way out of this one, but it takes action and it takes diligence. Yonis disease is a tough one. It's more related with wetter soil, so a lot of the western herds are not even going to be candidates for this one. Causes the intestines to not absorb well, leads to wasting, long incubation period time, very, very poor tests. So this is a headache in some areas, not in others. This one lasts in the soils up to about 2 years. So really what you need to do here is shoot for coming from a clean situation and how to manage it even if you have an infected situation. You can manage it, but it's tough. If your herd has it, it's tough to eliminate it. The goal is to stop shedding. This cleans up the environment over a period of years. Test the adults, realizing that the test will not catch all of them, but it's likely to catch those that are shedding. And these are the ones that are the greatest risk. If you test and you have a herd over 50 or so and none of them are positive, it's really, really likely that the entire herd is negative. If a few are positive, the herd is positive. Now the key here is that the test has not picked up every positive goat. And so you know you have an infected herd, you're going to have to act as if it is infected. You can control shedding by an age-related culling process. Older animals are more likely to shed, and depending on the situation, you can cull it 4 years, or you can pull it back to 3 years if it's a heavily infected herd. What you're doing is you may be culling some normal animals, but you're cutting down on the risk that anybody's shedding it, and you're slowly cleaning the environment. So if you stop the shedding, the environment eventually cleans itself up. You want a periodic herd-wide test, probably still appropriate, especially if a herd's had it. Do it annually, then you can do it every 2 years after that you've had several annual clean tests, probably the adults over 2 years, and then after you have several completely clean tests, probably anything over 3 years old, and then you can stop this age-related cull, and you can basically go on with a low-risk herd, or in some situations, just a minimal risk herd. Pink eye, nuisance more than a risk. Anytime goats are mixed, you're going to have this. It's usually self-limiting, but it can be really, really nasty. If you're bringing in goats from a variety of herds, what's happening is you're mixing pink eye strains, a whole variety of bacteria, and some people are going to basically treat this, other people are going to ignore it. It's really, really helpful if you don't have it to begin with. Abortions, some are specific pathogens, many are not. No single recommendation is going to catch all of these. This is going to be a really, really tricky, and as you mix animals from different herds, this can be the problem. As we do that, some are going to have abortion storms that move through them. The recommendation here might be a little bit different than with some of the other diseases. In this case, I would be very, very tempted to buy the oldest females I could that were still productive, because they're going to actually be resistant to the abortions that might be present in that herd. The youngsters are very likely to be sensitive to those. Slightly different recommendation there, but something to think of, something to watch for as you go forward building your herd.